I'm very grateful to the Alliance for inviting me here today to speak about evidence informing policy and practice. I'm going to take a case study approach, take education. I think from conversation with colleagues, a lot of the issues we face in education and work with the education profession are similar actually to ones in social work, in nursing and so on. But what I'd like to do is to look at some of the key issues and challenges that faces the education sector in making better use of evidence. There's clearly different forms of evidence, a wide variety of evidence addressing a wide variety of research questions. I'm going to focus on evidence that addresses a particular research question, and that is the question of what impact do interventions, education programs have in terms of outcomes for pupils. And clearly that type of research question requires a methodology which has some way of measuring progress from before to afterwards, and what gains have been made, and crucially also has the ability to say how much of that is above and beyond what we would have expected normally. So we're talking about control groups, comparison groups, and what I'm describing there, as you're all familiar with, is a randomised control trial. And it would seem that there's an obvious methodology for answering that particular question of what impact is a programme having on children. But it's very surprising to find still that in education and educational research, very few, comparatively, randomised trials are being done. And one of the reasons for that is that it's not just that they're not being done, but there's a strong resistance to trials in education. We're told, for example, that education isn't like medicine. You can't apply a medical model in terms of research to education. You can't measure things as you would do in a clinical drug trial. You can't control for all of these other factors which impact upon a child's learning in an experimental design. And we're told that even if you can do all of that, schools are complex systems and you just actually can't do randomised trials in most cases. It's not possible to randomly assign pupils in the way that you'd need for a trial. And in addition to all of that, we've got a teaching profession who, and I have a lot of sympathy with this, feel completely and increasingly undermined in terms of their professionalism being undermined by an ever more prescriptive curriculum, pressures on them to perform in terms of league tables and so on, and inspection visits. So you've got teachers who already feel over-controlled, over-measured, and there's a danger that trials get put into that discourse, that trials are also just seen as another way in which teachers are bashed. So there's certainly a lot of resistance to trials in education. However, the Centre for Effective Education at Queen's that I founded, which is carrying on now under the directorship of Professor Alan Thurston, we've shown in reality that you can do trials. You can work in partnership with educational providers and do trials. We've done over 20 randomised trials in the last couple of years. By our counting, we've done more trials as an educational research centre than any other similar centre in Europe. We'd try and claim to have done it in the world, but we're not as stupid as to make that claim, especially on recorded television. But we've certainly got a lot of experience of actually doing trials on the ground. So there's that mismatch between the resistance that we experience in education and the reality of actually doing trials. And what I'd like to do for the remainder of my talk, the last 5 minutes, is just to say, well, what can we learn from all of this? What are the key challenges facing us if we want to try and embed the use of evidence, the use of this type of research in professional practice? And there's 5 key points that I really want to draw out here, and they're only just touch upon them, but certainly in the panel discussions we can explore them further. The first issue of the 5 is capacity building. We know from national assessments of educational research in the UK that we are lacking in terms of enough sufficient researchers who can do quantitative statistical research. And actually, if we look at where the resistance comes from trials, it's not teachers. It isn't usually teachers on the ground. They get the idea of impact, of looking at what works and asking that type of question. The resistance comes mainly from particular sections within the academic research community who, not surprisingly, are also those that have little quantitative research skills. So my experience of debating a number of these things now is that there's actually a lot of ignorance around what trials are doing. So we need to focus on capacity building for the education research community as it stands, and remembering they're the same people who are training our future generations of teachers. So if we want to have a system change in terms of the teaching profession, their ability to understand and interpret and use evidence, then we need to actually look at capacity building of the education research sector. Secondly, and relatedly, what I've learned actually over a few years now is there's no point carrying on trying to have abstract debates about randomised trials and their use in education and epistemological and ontological discussions. I've got so little time in my life now, I'm getting older and older. What I've learned is it's actually much better, there's more progress to be made by just doing trials, and rather than trying to debate the idea whether they're doable or not, let's just do them. Let's do them and show that they can work, and actually more so, show that you can do it in partnership, so you address some of the concerns that I've mentioned at the beginning, and you can show the real benefits of a partnership, inclusive-based approach to generating evidence. And I think Northern Ireland is really certainly doing very well in terms of the funding we've had from organisations like Atlantic Philanthropies and funding trials. There's been a sea change here, not just in education, but in other sectors. And we certainly see that when we're involved in debates and discussions, people are now much more routinely talking about measurable outcomes and knowing what that means, and talking about the use of evidence and what works and what impact a programme's having, and effect sizes, that using terms like that. So still much more to be done, but the more that we actually we can get trials done, get them published, show their use, the more we'll actually see things change. Thirdly, we do need to take heed of the concerns that I've outlined at the beginning of this talk. They are real concerns to teachers who are feeling undermined. The way to deal with that is through partnership working. That was mentioned at the beginning there. We've got a lot of experience now of working in partnership with education providers, programme developers. And not only is it a good way of allaying fears and developing a much more inclusive approach, but it's actually good practice. In terms of programme design, obviously we need people that know the areas, know the subjects, know the programmes. In terms of identifying outcomes, who's best people to ask other than the people delivering programmes what the outcomes should be, and most importantly, in terms of interpreting the findings, when you get trials, and we get many of them where there's no effects or there's negative effects, you know, we need to work in partnership to understand that and to make sense of it and work out how to disseminate those findings. So working in partnership is the third area. Fourthly, I think we need to keep our feet on the ground as researchers as well. The use of the notion of what works as a term, as a research question, is a shorthand for us. We know what it means. We know that it involves qualifications in terms of how that's applied. But in reality, we are always in danger of sounding like we're going back to a medical model. That we will do a trial over there, we'll show you what works, and that will therefore work everywhere. And we need to recognise that the question, what works, actually doesn't make much sense in and of itself. Nothing works without a context in which it takes place. So we clearly need the longer hand phrase of what works for which pupils, in what contexts, at what time, or at what times. And that requires in itself better research designs in terms of trials which are able to start exploring questions about whether, not just whether the programme works overall, but does it have differential effects for particular groups? Does different contexts make a bigger or lesser effect on the overall impact of a programme? Does the programme fidelity and so on have an impact? So we need to be much more feet on the ground in terms of what we claim and generalise from our trials, but also in terms of what we're studying. And relatedly and fifthly, we also need to make much more use of research synthesis. We need to be wary of trusting the findings of one single trial, particularly if it's a pilot efficacy test. Rather, we need to be spending much more time now and putting more resources, not just in generating evidence, but in making much better use of the wealth of evidence that exists already. And through a technique known as meta-analysis, we can combine the data from a whole range of studies, and we can really then start to look at those broader questions of context, of differential effects of programmes in different ways when we combine the effects of a whole range of studies. So in summary, the use of RCTs in education is still the exception rather than the rule, but as I've set out, there's a lot of resistance to it, but there's also a lot of potential and a lot of evidence now that we can actually do them in practice, and we can develop partnership approaches. That isn't to say that there aren't a lot of challenges ahead. The 5 that I've laid out here really are, there's probably more we can add to that list, but certainly in terms of capacity building, firstly, undertaking and modelling the use of trials, secondly, working in partnership, as a third area, being inclusive in our approach, being careful in how we interpret and report our findings, not overgeneralising from what we've done, and fifthly, much better use of research synthesis to contextualise and ground what we've found. Those are the 5 key challenges that have come out from our experience in Northern Ireland. Given the time constraints, I've only just sort of painted a quick picture of those, but very happy later on to sort of talk about them more. So, thank you very much.